Only about 3% of people who can donate blood actually do, and that's bad news for Americans who need blood or platelets every 2 seconds. That's according to the Red Cross, which is why January, National Blood Donor Month, encourages people to do just that. Joining me now is Dr. Michael Tees with the Blood Cancer Institute. Thanks so much for taking time to talk with us today. Appreciate it.
Thank you for having me. Appreciate it.
First off, I mean, it's a low number. What do you think stops people from donating blood?
Yeah, well, that's a good question. I think a lot of people just don't understand the importance of it. You're helping your neighbor when you donate blood. The majority of the blood products that are collected in the state of Colorado and beyond actually stay in that area. So you're helping your neighbors when you donate. But I think it's just a lack of knowledge and understanding of that and how to do it.
Well, a simple question, but a big one is, why is donating blood so important?
Yeah, absolutely. I mean, it's absolutely critical for supporting many of our patients throughout their journeys, whether it's through blood cancer treatments, whether it's solid tumor cancer treatments, whether it's a surgical procedure that a patient needs. Blood products is really what drives us that really drives the treatments that we can give. To example, of course, my specialty is blood cancer, lymphomas, cell therapies. We can't do what we do without it. For us to knock down a blood cancer, we have to knock down the good cells. And while we're waiting for those good cells to come back, we do need to support that with blood products.
Yeah, and that's just one of, I know, the many reasons or ways that donating blood can help. For people who are interested, what do they need to do?
Yeah, so you could simply Google it, but Vitalant.org is the large organization that in the region that really supports the majority of the blood products that we get. And there's multiple locations where they can donate. Here at Presbyterian St. Luke's, we also have a donation center as well. So if patients are interested, they could also reach out to Colorado Blood Cancer Institute, and we can give them more information as well.
I wanted to ask you this. I know the FDA is considering changing restrictions on blood donations from gay and bisexual men. How do you think that would impact blood donations?
Well, so that's a historic problem, I would say, to selectively exclude certain patient populations. And there are some reasons behind that, primarily that if it is identified that someone does have a new diagnosis of a transmissible disease, that there does need to be appropriate education and really connection to appropriate care providers for that to occur. I think realistically nowadays, though, that needs to be it needs to go away. I think it would open up the door for many more donations, and it's just a historic issue that is irrelevant in today's society.
Yeah, well, hopefully this encourages some people who see this to get out and go donate. Thank you so much for your time today. We appreciate it.
Of course, thanks for having me.
All right, don't forget, you can watch all of our health interviews right now on CBSColorado.com.